Ladies and gentlemen, good morning. I'm Dr. Xie from Sun Yat-sen University, Guangzhou, China. My topic today is about the fusion 3D contrast ultrasound for faster, precise assessment of tumor ablation safety margin. This is our university main building, and this is our hospital main building. Our hospital is established in 1910. As we know, ablation is the first-line treatment for HCC less than 3 cm. The treatment progression of HCC prolonged the patient's survival time, but local tumor progression (LTP) is still a problem. The primary cause is the insufficient safety margin. Safety margin is measurement is still a quantitative assessment by compare the tumor size and the ablation zone size. Just this picture, 1 cm tumor, 2 cm ablation zone, so we think the safety margin is enough. This is a typical clinical case: 2 cm tumor and 3 cm ablation zone, so we think it's okay, but the local tumor proliferation rate is about 9 to 25 about the paper. Why? Because the size depends safety margin assessment is depend on the ideal situation, but it's not always ideal situation. The real situation is maybe the situation A, B, or C. In A or C, the local occurred can due to the insufficient safety margin. So, how to get a volume safety margin to get a quantitatively assessment is very important. By CT, we can get the precise volume quantitative data of safety margin by the 3D CT reconstruction, just like this picture. Before ablation and after ablation, we can segment the tumor and the ablation zone. Then we fusion the two volume image. We can get the safety margin in every direction, everywhere. You can get the measurement is very precisely and visible, but a little bit time consuming and not immediately after ablation and some radiation. What can we do by contrast ultrasound or ultrasound? Can we get a 3D volume imaging before ablation and get another 3D volume collection after ablation? And then we fusion the two imaging so we can get a imaging just like this picture. We can find everywhere and we can see everywhere the safety margin what we are, and we can find the insufficient safety margin location. So you also can get a multi-slide just in this picture to see any direction visible and to measurement the safety margin anywhere. It's simple, good cost effective, and low radiation, and we can do that after ablation immediately. Just like this moving how to radiation the imaging the ablation by 3D volume. Tumor is here. Firstly, we take the 3D-CEUS or contrast data, and then we mark the safety margin. and then we used ultrasound guided ablation. After ablation, we collect the volume of ablation zone by contrast ultrasound, and then by the registration of the main trunk of the vessel, we can registration the volume of the tumor before and after ablation. Then we can get a local selection by multi-slide, so we can get the tumor safety margin, the MVL, and the MD slide. We also can find the insufficient safety margin here. In order to get that, we must to improve the normal dimensionality fusion image of 3D-CEUS evaluation is feasible. We first to develop the new glycerin, and then to validation in vivo, and then we get the verification in clinical. Here is our fusion system. We use the Midray 3D contrast ultrasound machine navigation system. Here is the evaluation system. Firstly, we developed a new glycerin, and to get a faster registration and improvement the segments of tumor, we set up the fusion system. Firstly, we verification the system in vivo. Here is our model. We use big brown balloon to mean the ablation zone. Small balloon is to instead the tumor. Then we get a 3D correction, and then to get a multi-slide in here. So we made two models. First model is for insufficient safety margin, just here, and 2D in here. And we use the 3D correction and get a multi-slide. Here we can see precisely just like the model. Here is the insufficient safety margin. The model 2 is a safety margin. It's larger than 5 mm. Here is the balloon, and here we can see in 2D, and we also can see in multi-slide model. You can see everywhere the safety margin is bigger than 5 mm. And then we take the clinical preliminary verification. The purpose is to compare the 2D safety margin and the fusion 3D safety margin. And then we compare the consistent diagnosis of the safety margin in fusion 3D contrast ultrasound and in fusion 3D CECT. And then we also analysis the predictable between the safety margin and the local tumor progression. We included 105 cases in our study. Here is our workflow. We take data, ablation, and we take the data and the CECT again, and we fusion the CECT and fusion the 3D-CEUS and the safety margin measurement and compare. We must make sure the safety scan in the safety condition when to acquire the 3D contrast ultrasound image before and after RFA is very important in our study. Here is instruments and equipment. We use 2D machine, Toshiba, and 3D contrast ultrasound by Maitri, and the 3D fusion system is also by Maitri, and the 3D CT fusion system is at the AQQA level. The contrast agency is used SolidView. Here is the CECT fusion system. By registration of the Brazil and we fusion the 3D image before and after, and we can see the fusion image and can get multi-snide. So we can get the safety margin is no safety margin or less than 5 mm or not than 5 mm. In the 3D contrast ultrasound fusion, we take the 3D data before ablation. It can show the tumor and vessel very well. And then after ablation, we can get the similar data again. So we compare and fusion the tumor volume and the ablation volume here. Here is our work step by step. Segmented the tumor before ablation. Here. And then segmented ablation zone after ablation. Here. And the fusion the two volume imaging. Here. And then to get multi-snide to measurements everywhere, every direction of the safety margin. Results. First, we observe the fusion time. We found our system is very fast. It's less than 10 seconds in fusion image. The fusion outcome, the successful rate is very high. It's about 19% by automatically. Third, we compare the safety margin in 2D contrast ultrasound and in 3D contrast ultrasound in 197 cases. We can find the patients in 3D or 96 patients in 197. We all get the safety margin is larger than 5 mm. But by 3D fusion image, we only find 16 patients have safety margin is larger than 5 mm. In 31 is not enough. And we compare the 3D CEUS fusion to compare with the 3D CECT fusion. We can get the same result. It means the contrast 3D fusion is have good consistent with the contrast CECT in variation the safety margin. By case, we can see this case in 2D CEUS safety margin is 9.5 cm. By contrast ultrasound, safety here the tumor is 6 cm. The ablation zone is 6.6. It's about 5 centimeter. The safety margin is good enough. But by 3D contrast ultrasound fusion, you can find in play B, here is not good enough. The safety margin is less than 5 mm. And then we use the 3D-CT fusion to validation of ultrasound diagnosis. By the reconstruction 3D, we can find in risk in here is not good enough safety margin. We can also see the safe situation in here and in here is not good enough. Firstly, we analyze the evaluation effectiveness of safety margin by the different methods. By 2D contrast ultrasound, the accuracy is only 16.23. By the CEC 3D contrast ultrasound, it's about 94%. So it's very high than the 2D contrast ultrasound. It suggests the 3D contrast ultrasound fusion image is better than 2D contrast ultrasound in evaluate the safety margin. Here is the research about the ROC curve of the safety margin by different measurement machine methods. In fifth, we compare the two fusion imaging have good consistency in the evaluation system. We compare the CECT and the CEUS fusion have a good correlation. The cup volume is 0.897, have an excellent consistency. We also observation the safety margin prediction of the local tumor progression. In our group, having followed up about 12 months, we found 8.3 LTP. The all LTP, we can find the safety margin is less than 5 mm. Here is the detail of the recurrence patients and the no recurrence patients and the safety margin. We cannot find the local tumor progression of patients with safety margin is larger than 3 mm. Here is the patient. You can see here is the ablation zone. The safety margin is not good enough, and 4 months later, recurrence is occurred. And his case 1, tumor ablation zone is big enough. 2D and 3D, the safety margin is also larger than 5 mm. And also we can see in CT tumor and ablation zone and the volume of ablation zone and tumor here, the safety margin is good enough. In case 1, case 2, tumor 2.8 cm, after FA, the ablation zone volume, you can see in this direction, it's not enough, not big enough safety margin. The same situation in CECT and in multi-slide. 1 year late, recurrence is occurred. In case 3, here is the tumor before ablation, after ablation. Here maybe it's not good enough. 6 months late, recurrence occurred. In conclusion, normal modality 3D contrast ultrasound fusion can lead to precise registration and segmentation of tumor. And the 3D contrast ultrasound, normal modernity image fusion, is fast and precise quantitative assessment of tumor ablation safety margin. It may be helpful to improvement the ablation efficacy. And we also can use the Fusion 3D contrast ultrasound for tumor ablation guidance. We can take the 3D volume data and then segment the tumor, and then we can puncture the tumor by the 3D guidance, just like this picture and like this picture. Maybe we can not get the gas. You cannot get the gas established anymore. Thank you very much. Here is our department and our co-work. Thank you very much again.